Join us now for Health for Life, brought to you by Hamilton Healthcare System. Today we're talking with Dr. Lee Connor of Hamilton Healthcare System and Hamilton Physician Group Specialty Care in Dalton, Georgia. Thank you for joining us today, Dr. Connor.
Thank you so much for having me.
I'm glad you're here. Dr. Connor is a board-certified infectious disease specialist. He completed his medical training at Florida International University, Herbert Wertheim College in Miami-Dade County, Florida, and his residency and fellowship at Wake Forest University School of Medicine, Winston-Salem, North Carolina. He practices at Hamilton Medical Center and Hamilton Physician Group Specialty Care down the street from Hamilton Medical Center. Hamilton Physician Group Specialty Care houses several physician specialties, including infectious disease, pulmonology, and rheumatology. Dr. Connor, how have you been doing?
I've been doing quite well, thank you.
Well, I'm glad that you came back to visit with us. It's always good to see you. Today we're talking about tuberculosis, and they call that TB.
Yep, TB.
Tuberculosis.
Yeah. Tuberculosis is a mouthful.
What exactly is tuberculosis?
Yeah, you may have heard stories like back, decades ago, grandma or grandpa having tuberculosis and the family being treated.
It must be a highly contagious disease.
It can be, yep, when it's active. So really there's two types, active versus latent.
What's the most common?
So latent is the most common. That's when the bacteria is inside your body but isn't doing anything. It's just hanging out, waiting for an opportunity to show itself and give you symptoms. And active is when you develop actual symptoms and you're coughing, and that's when you're spreading this bacteria up into the air, and then if someone breathes that in, then they become infected and may become latent at that point. But yeah, it's an odd bacteria. It's in a family of Mycobacterium. So
is it a common disease? Do you see much of it?
Not as much as kind of the other things that I deal with. It's definitely one that has sort of red flags, definitely catches my attention. But, with public health stuff, TB has become much less common. But we still have that, travelers coming through from other countries. They can have tuberculosis. We screen them. We want to get everybody treated and then especially target those people with latent tuberculosis and get them treated before they even develop symptoms. So that would be the most ideal people to get.
Well, now, how long has tuberculosis been in our, has been in our community? How long has it been around?
Probably since the very beginnings of time. I think they've seen tuberculosis in mummies, evidence of that. So it's at least documented, probably 5,000 something years ago. But it's probably been with us for
forever,
as long as we've been. Yeah, recorded history at least.
Another question that I've often wondered about tuberculosis or TB is how many people who are infected will develop an active form of it. You said there's two forms.
Yep. So they
go from the dormant to the active.
Yep,
what is the dormant? What'd you call it?
Latent TB.
Latent TB. And then they go to active TB. My question is how many people will make that jump?
Yep. So, there's millions of people who have been infected with tuberculosis, but the percent that go on during their lifetime is about 10% to that active phase. And it's hard to predict who will end up going into active TB, but we do see a lot of issues going forward with people on immunosuppressants, for either cancer or rheumatologic diseases. There's a lot of medicines that suppress our immune system, and that TB is looking for an opportunity when our immune system isn't in check. It'll use that opportunity to manifest itself into active TB. So, yeah, about 10% of latent TB will turn into active TB. But, with all of the medicines we have nowadays, we want to just be extra careful when we're suppressing someone's immune system. Also, when people are in close contact with each other, prisons, any sort of like dormitories, that sort of stuff. When people are in tight groups like that, you just have one person that converts to active and the whole place can be infected. And
you were talking earlier in this show about you coughing. Coughing. Is that the major or the easiest way that tuberculosis is spread in a community is just by people coughing and other people breathing it?
Yep.
So you don't have to have blood to blood, nothing like this. Is just airborne.
Yep, it's airborne. So it hitches a ride on our respiratory droplets when we cough into the air, and that goes into somebody else's lungs, and then it takes a foothold. When you talk about active TB, that's probably the one that people think about the most is the pulmonary process, where you're coughing it up, it's affecting your lungs, it's doing damage there. There's also other forms too. It can be isolated in random lymph nodes. It can even be so bad as it can get into the brain or the meninges, the lining of the brain, and so you can have meningeal TB, and that can be a devastating illness with a high mortality rate. And so active TB, it's a public health hazard, but it's also very, detrimental to the individual with it too. So getting them on treatment as fast as possible before they can infect others is paramount to treating it.
I've heard tuberculosis infection, and what's the difference between infection and the tuberculosis disease? Is there really a difference in those two?
Yeah, it's mostly going back to that latent versus dormant disease.
So latent would be the infection.
Yep, infection with it would be latent, and then the disease is when it manifests symptoms, and then we would call it active TB.
Well, now what kind of tests are done to see if someone has tuberculosis, whether latent or active?
Yeah, so active is a little more complicated, and we can talk about that. But latent, this is the people we really want to get an eye on too, is, the people that are walking around where they do run that 10% risk of reactivating and going on to developing symptoms. But if we can catch them before that and treat them, then they can be cured of it. Yeah, so the latent TB, we want to test those people, and it's a very simple blood test. That's kind of been the new thing now. It used to be a PPD, which would be, and people in the healthcare system probably remember this, is getting a little injection under their arm to see if they reactivate or, inflame that area, and that would be evidence of TB infection. But now we have a blood test, which is even better and more sensitive, specific, and so we use that as, quantiferon gold is what it's called, and so a simple blood test that can be done at anybody's primary care office, in the hospital for sure, and that can tell us if it's latent TB is there. And then once we have a positive test like that, then, you really want to exclude active tuberculosis at that point. And so because the treatment's different, latent TB is usually just one drug, and then active TB is 4 drugs, and we don't want to misclassify somebody and undertreat the TB. And so active would be more of they're having respiratory symptoms. We would then take a look at their sputum cultures and, do some specific testing of what they're bringing up from their lungs, that sputum. So we can look at it under a microscope. We can do some special PCRs, which is like how we look for COVID. People probably learned about PCRs and during this epidemic. Mm-hmm. But yeah, we can do some special PCR testing on it to rule it out or rule it in. And then that kind of decides what our treatment will be for that individual.
You've talked about coughing and a lot of coughing, and that is definitely a symptom of TB. But are there other symptoms that we should be looking for?
Yep. So coughing is a big one. And then, unfortunately, it's a little bit non-specific, but, unintentional weight loss would be one. Fevers that are, comes and goes, kind of hard to pin down. Night sweats. And when I talk about night sweats, I'm not where you just shed a blanket and you're better. I'm talking about like drenching the sheets, mm-hmm. drenching your pajamas. Those are kind of your typical tuberculosis symptoms. So if you're having cough with this fever and this drenching night sweats, that would definitely raise my suspicion. And we need to really kind of pin down what's going on in this patient.
We've talked about, not just in this show, but in past shows, there's so many different symptoms that are the same for other things.
And I've had, patients just present with like a lymph node in their neck, and then you go after it with a biopsy, and it's loaded with tuberculosis, and they have no cough. It's,
so you can get it in other places other than your lungs.
Yep, we call it extrapulmonary tuberculosis, so just not the lungs. It's a fancy word for that.
Yeah, I got you. Now, how do you treat TB? If somebody came in, you found out they had tuberculosis, how would you start treatment? What would you do?
So I would, first we call it either latent or active. If it's latent, that's a much easier regimen. So one drug for latent, you've essentially been cleared of the tuberculosis that's been just hiding out in your lungs, waiting to, go on to being active. And so at that point, those folks are totally done and in good shape.
Do they still have tuberculosis? It just is not manifesting itself?
Nope. After the drugs, we've eradicated it.
It's gone.
Yep. So they don't have to worry about reactivating down the line. So they're in good shape. Those are the people we really want to get a hold of so that they never end up in the active group.
But if they do get in the active group,
then we're talking about 4 drugs is typical, and we're still going for a long period of time. 9 months is the usual duration of therapy. But yeah, it's 4 drugs that are every single day, have to be very compliant about. Fortunately, through the health department, a lot of these drugs can be provided for free, and they can do some additional testing because they, from a public health perspective, it's huge to, get these active cases taken care of and also treat some of the latent TB as well. But yeah, it's still a long haul in terms of treatment. And so this bacteria divides very slowly. And so it does take quite a while for us to totally eradicate it. But yeah, if we can catch you at latent and do a 1-drug regimen for 4 months, that's the easiest. But, if you are active, that's not a huge ordeal. We'll get you on treatment. It'll be 4 drugs and we'll get it.
But do you have to stay away from other people?
You do for a temporary period of time if you have active TB while you've been getting the meds before we, kind of clear clear you to be out and about.
So dangerous in schools.
Schools, corrections facilities, barracks.
You mentioned dormitories. I've got a daughter in a dormitory.
Mm-hmm. Yep. TB testing is, a criteria for a lot of places where people are in close quarters and, where if just one person activates, you could have a whole floor exposed, a lot of individuals exposed.
So if you feel like you've been exposed, you definitely need to go and take that medicine.
Get tested, that blood test or that PPD test, and then, we can address things as they come. And sometimes we'll test you several months down the line just to see, if it did take a foothold in your lungs. So, periodic testing if you've had a big exposure.
Tuberculosis, TB. I've learned so much today. I'm so glad you came to visit. I appreciate you.
Well, thank you for having me, yeah.
Dr. Connor, always good to have you on the show. For more information or an appointment at Hamilton Physician Group Specialty Care, call 706-529-3072 or visit hamiltonhealth.com/specialty care. This program in no way seeks to diagnose or treat illness or to replace professional medical care. Please see your healthcare provider if you have a health problem. Thank you for listening to Health for Life, a presentation of Hamilton Healthcare System.